CT scans to determine your heart calcium score help to diagnose coronary artery disease. The higher your score, the more likely you are to have issues with plaque building up in your arteries. And this morning, our daytime cardiologist, Dr. Shoba, is here to further explain more about calcium scores and hardening of the arteries. Good morning, Dr. Shoba.
Good morning.
But CT scan, that's where it all kind of begins.
That's correct.
Yeah.
When people have risk factors for heart disease, the question becomes, do I already have plaque buildup in me or not? So for example, let's take a 40-some, 50-some-year-old, 52-year-old gentleman who's got diabetes, or pre-diabetes, early diabetes, and smokes a little bit. There's some family history of heart trouble. Father was age 62 when he had a heart attack. And his eating habits are not the best. He likes to grab the pizza, the French fries, the hamburger. That's his usual meal. And then he presents to his doctor's office. He's having no symptoms whatsoever. He's on some blood pressure medicine, some cholesterol medicine. The question at this point becomes, what can we do further to risk stratify him? Does he already have plaque buildup? What can motivate him to take better care of himself? And a simple test out there is something called a CT scan of your heart, specifically something called a CT coronary calcium score. And what it does is it looks at calcium buildup in your heart arteries, that is the hardening of your heart arteries. And if you have that, you already have heart disease.
And like I said, the higher that number on your calcium score, the more danger you are of having coronary artery disease.
That is correct. Normal calcium score should be 0. There should be no calcium buildup in your heart arteries. The higher the number, the higher the chance that you actually have a significant blockage. Any calcium at all tells us that you've got plaque buildup. Gunk is already getting deposited in your heart arteries. But if you have a calcium score, say over 400, then the odds of having a tightly blocked artery becomes very high.
Who should be going and having these CT scans initially to find out about their calcium score?
I think people who have risk factors for heart disease. If you already have heart disease, you already have a stent, you've already had open heart surgery, it's a moot point because we know that you've got heart disease already. But in that individual, like I said, who has some of these risk factors, high blood pressure, high cholesterol, does not exercise regularly, is a little bit overweight, smokes, family history, you take all these risk factors, that would be an ideal person to get the CT calcium score, especially if they are asymptomatic. If you're having symptoms of chest pain, you need to be more aggressive, do other kinds of tests, stress test, heart cath and all that to see how much blockage you have. But if you don't have any symptoms, this tells you what's going on inside your heart. And it's a very simple test. CT scan is just a simple machine. You go in there. Actually, the test takes, it's just like a breath hold, 10 seconds. The test itself is done. But, filling out the paperwork, laying on the table, all that might take 10 minutes. There's no IV involved. Nothing is injected into you. So no bruising, nothing like that. You can just slide in the scanner. And at the end of the test, sometimes you'll get a report handed to you. This is your calcium buildup. And sometimes if the calcium buildup is in the main arteries, that becomes even more, sometimes it tells us, especially if you have a very high calcium score, and the location of the calcium score in your artery is very important.
Let's say that we have the CT scan and our calcium number is very high. What are some steps that we can take to get that number down?
I think the key thing is risk factor modification. I think it's very difficult to reverse calcium score. I'm not saying it cannot be done, but it's very difficult to resorb all that calcium buildup. But you need to lead a healthy lifestyle. Nothing beats that. Diet and exercise and eating healthy, taking your blood pressure medication, keeping your cholesterol under control, so crucial in preventing heart disease from getting worse and from having a heart attack. And depending on certain findings, your doctor might advise further testing.
All right. Dr. Shoba, thank you so much for stopping by today. Great information that we all need. Thank you so much. We have a number and a website right there for more information.